going to demonstrate to you the proper way on how to obtain an arterial blood gas. First, we want to make sure that the patient meets the proper indications. Some indications in regards to performing an arterial blood gas is we want to make sure that, it checks the patient's ventilation, oxygenation, and arterial blood gas, or acid-base balance, should I say. And we're going to go ahead and take a look at the patient's chart. While observing the patient's chart, we want to make sure that there has not been any changes to the patient's oxygenation. If the patient is on any type of oxygen therapy, if there has been a change, then we must make sure that we wait at least half an hour before going into obtaining this. We want to look at the patient's chart for any contraindications. We want to see if they've had a negative Allen's test, which I'll perform and demonstrate to you in a bit. We want to make sure the patient does not have any shunts or is not on any anticoagulant medication. Okay, we also want to make sure that the patient does not have any allergies to any iodine or any latex gloves. And then we are going to go ahead and gather our equipment, and this is going to consist of gloves. When using gloves for this, if it's possible, it's recommended that you try to use one size smaller if you could. The reason for that is because it's going to be more closer to your skin. That way you could be able to, when obtaining the patient's pulse, it's a little bit closer to skin contact. We're going to go ahead and also, grab our equipment, our ABG kit, and I'm going to go ahead and demonstrate what's inside the ABG kit. Inside the ABG kit is your biohazard bag, which you're going to need for after, a 1 ml or a syringe, a heparinized syringe, and in here there's a little, if you can see, there's a little heparinized little pellet in there. And so the reason that it's in there and it's heparinized is because it's an anticoagulant, and we don't want to have the patient's blood sample coagulate, because then it's going to affect the readings. In this case, if it were to be too much heparin in the sample, it could show indications of a decreased carbon dioxide level and increased blood pH on the patient, and it could also affect increase or decrease the patient's oxygenation results. Okay, so we just want to make sure that we avoid having too much heparin.
Okay, thanks.
And then we're going to be using a 20 to 22 gauge needle for this. And then here is a cap that we're going to use after. It's like a little air bubble cap, or that we're going to place after. And then here is a iodine swab, an alcohol prep wipe, a gauze, a band-aid. A band-aid is not necessarily needed, however, it's used for the patient's the purpose of the patient's comfort. And then a requisition form. If you could have 2 requisition forms, it would be best. On the requisition form, you're going to, before you go in, you want to make sure that you write down the patient's name and date of birth. You want to write down the time that you are going in to obtain the sample, the temperature of the patient, respiratory rate, heart rate, and also if they're on any mechanical ventilation or any oxygen, you want to make sure that you indicate their settings. Alrighty, so we've got this. And then I'm going to go ahead and grab 3 ml of hand sanitizer, or you're going to wash your hands for 15 to 20 seconds. Okay. And we're going to go ahead and go in, grab our gloves, go into the patient's room, knock, knock, knock. Hi, my name is Mickey. I am a respiratory care student. I'm here to obtain a arterial blood sample from you. Can I please have you state your name and your date of birth? They're going to go ahead and do that because you want to have the patient identifiers. And then they went ahead and stated that. You're going to go ahead and check their wristband, make sure that it matches. Okay. Before I proceed, I also want to mention that this is considered an invasive type of a procedure. There is a different way to check this that are non-invasive ways, and that's via pulse oximetry, a capnograph, or a transcutaneous a way of obtaining, and again, it's a those are non-invasive ways of doing this. Okay, so I'm here because I'm going to again check your collect the arterial blood sample from you, and this is going to, you want to explain to the patient why you're doing this, and this is just to check your oxygenation, your ventilation in your lungs. So this is specifically for your lungs, and so you're going to go ahead and ask if that's okay. Make sure there's no questions. You want to also mention to the patient any side effects or anything that could basically happen to them, which could be the patient could obtain a hematoma from this, or a possible infection, or hand ischemia on this. Okay, and so you're going to go ahead and grab your sample. And you could also pull up a table next to you, just so you could go ahead and put your stuff. Before performing and performing this, you want to make sure that the patient has a positive Allen's test, and that what that Allen's test checks for is for make sure that the patient has proper circulation that is required. And the way that it's done is you're going to go ahead and with your index and middle finger, you're going to go ahead and place them on the radial pulse and on the ulnar, and you're going to have the patient make a fist and open and close for five times while occluding both ends, and then you're going to let go. You want to make sure that it returns back to being pink, and it has to return back within 5 to 10 seconds. That means that the patient has good circulation and it's a positive Allen's test. If it were to be, if it were to not return, the circulation were to take longer than that, then you want to perform it on the other hand to see if that one is a better choice. If the patient were to be unconscious, it could still be performed. However, the patient's unconscious, you're still going to occlude the radial and the ulnar artery, and you are the one that's going to provide this circulation to the area. It's turning white, so you're going to let go, and it's coming back, and you're seeing the coloration coming back. Okay, so this is a good positive Allen's test. Now, it's not just on the radial where this blood sample could be collected. It could also be collected in the brachial and femoral. So there are other options. In regards to that, with your angles for your syringe, if you're going to be collecting it in the radial pulse, your angle that you want to use for your syringe is going to be a 30 to 45 degree angle. If you were to use collect it in the brachial, you want to use a 60 degree angle, and if it were to be femoral, then you use a 90 degree angle. Okay, so now when you're going to you want to make sure that you position yourself where you are comfortable, because you're the one that's going to be collecting this sample. And so you're going to go ahead and take the stuff out here, and also another important thing that you want to keep in mind, or that you want to bring in also, is you want to have an ice pack with you, because after obtaining this sample, if you're not going to run the sample within 15 minutes, then you could place it in the ice bank, and then you have up to an hour to run that test. If you were to take longer than an hour, then the sample is no longer good, and you would have to repuncture the patient, so you don't want to do that. But again, you put the sample in the ice pack if you know you're not going to collect it within the 15 minutes. Okay, so you're going to go ahead and let the patient know that you're going to be setting up here. So you're going to take everything out. So here's your bag, your requisition form. You already completed it before you went into the room with the patient's information. Okay, you're going to ask the patient if it's okay if you could go ahead and just place the gauze and the band-aid on them. If they say no, then you just put it somewhere where it's a little bit more convenient for you. Okay, going to have all this, and again, you're going to put this aside. You want to position yourself where it's more comfortable. Now, you also could have a towel So you could place it underneath the patient's wrist to hyperextend the wrist, and possibly it could be a little bit more easier for you to check the patient's pulse. Now, we have been mentioning that it's a radio, but because of the fact for video purposes, we're going to pretend that this is the radio right here. Okay, before you collect, you want to make sure that you draw back at least 1 cc. And the reason we want to draw back 1 cc is because we're going to be collecting a 1 cc sample due to the purpose of some analyzers require more sampling, and you would just want to make sure that you're prepared to have enough sample ready. Also, just in case the nurse, for whatever reason, or the doctor is needing some arterial blood for testing, for their further testing, you have enough that you could share it with them, because again, it's teamwork, and you know, that way you could avoid having to repuncture the patient. So what we're going to do is we're going to go ahead and get our iodine swab, and we're going to go ahead, open it, and then we're going to check for pulsation. Okay, it's right there. And we're going to go ahead and start from the center. After we opened it, we're going to start from the center and in a circular motion, clean from inside out. And you want to use at least a 1 inch diameter or 2 inches. And then you're going to do the same thing with your alcohol prep wipe. After you open it, start from the center and in a circular motion, work your way out. Now, the reason we want to do it in a circular motion is because we want to avoid doing it the opposite direction, because we do not want to introduce any bacteria into the site. And also, you do not want to fan dry the area, because again, you do not want to introduce any possible bacteria onto the site. Okay, so once we have done that, we're going to check right here. Okay, and then, okay, so excuse me for this. Okay, I'm just sorry, you're not going to do this in front of the patient. Okay, so sorry, I just had to get that ready. And we're going to check for pulse. And as you hear, we're going to go ahead and put the bevel up. Okay, and you want to, when you're going to go in, you don't want to go in all the way first. What you want to do is you just want to go in slightly in, just into the bevel is in, because if the patient is going to move, that's going to be the time that they're going to move. And then once they went ahead and made their twitch or move, then that's when you're going to go in all the way. Okay, so you're going to lift, and here's the strongest pulse, and on the count of 3, 1, 2, 3, go in a little bit, and then you're going to go in and see if there's any blood draw. Now, in this case there's not, so what I'm going to do is I'm just going to take the needle out slightly, not all the way, and I get 1 attempt to redirect. Going to check the pulse again, and we're going to redirect. Okay, and we're going to go in. Okay, so in this case it's not working. So what we would do is we would go ahead and take the needle out. Okay, and for the purpose of this video, I'm going to use this needle again, but realistically, you do not use the same needle. For you get a new packet and you do the whole process all over again. But again, only for the purpose of the video is that I'm going to do this. One important thing that you want to know is that you get 2 attempts, and with each attempt, you only get 1 redirect for each attempt. If after the second attempt you are still unable to obtain the sample, then you have to grab another respiratory therapist to go ahead and attempt this. Okay, so again, we're going to pretend that I obtained a new needle. Okay, check. Okay, and 1, 2, 3, we're going to go in, and then There we go. And we got some. Okay, but it's taking a little bit longer, so I'm going to go ahead and withdraw again just a little bit. Here's my redirect. Okay, and there we go. So it's just taking a little bit longer. Again, for the purpose of the video, this is why I'm only going to make that adjustment. But other than that, we do not do this inside the patient's arm because we want to avoid doing a scissor effect inside the patient's arm. But I'm only doing this for the purpose of the video, just so I could go ahead and collect all the blood samples so you could see. Again. So again, you do not do this with the patient, but I'm only doing this for the purpose of the video, just so we could go ahead and collect the full sample while putting pressure right there. Okay. And looks like we've got pretty much a good sample right there. So what we're going to do is we're going to go ahead and grab the gauze, place it on the patient, take this out, okay, and we're going to go ahead and cap our needle, okay, and then you're going to continue to apply pressure, and you're going to apply pressure for 5 minutes. If the patient were to be on any type of anticoagulant, then you're going to apply pressure for 10 minutes, okay? However, it is important to know that you never leave the room if the patient is still bleeding, okay? You always want to stay there until they're done bleeding. Until they're no longer bleeding. So what I'm going to do is, while I'm applying pressure, is I'm going to go ahead and remove the needle. Okay, you want to do this very carefully, away from the patient, okay? And then you're going to go ahead put it on this, and you want to make sure that you don't have no air bubbles, because those could affect the readings. You want to go ahead and push up a little bit. If you were to have any air bubbles, what you could do is you could go ahead and tap it. Okay, and you just push up. Okay, just to dispose of any air bubbles. Okay, there you go. And then once we did that, then we could go ahead and do the figure 8, just so we could go ahead and mix the blood with the heparin that's in there. And so we're going to pretend that the 5 minutes are up. I'm going to go ahead and place, the patient is no longer bleeding. I'm going to go ahead and grab my bag and place this inside the bag. Before I place it on the bag, I'm going to apply the requisition form and put it on there. And if I have an extra one, put it on the bag. I'm going to dispose of this in the sharps container. And I'm going to go ahead and put a band-aid onto the patient, again, just for their comfort, and just make sure that they're doing okay, make sure that they don't need anything. And then I'm going to go ahead and remove my gloves. Say thank you to the patient. Wash my hands. Go run the sample. Once I run the sample, then I'm going to go ahead and obtain the results. Any results that I obtain, I'm going to go ahead and inform the team that's working with my patient. In this case, it could be the nurse and the physician. And I'm going to let them know what the results were. And I'm going to document in the chart if the patient had any type of reaction. I'm going to put down what time I collected the sample, the ABG results that I obtained, and if there were to be any complications. Okay, so this is how you obtain an arterial blood gas. Thank you for watching.